And we are back on InMore Clinical Conversations, where knowledge meets practice and confidence is built through clarity. Hi everyone, I'm Doc Louie and I'll be your host. In our previous episodes, we have learned how personalization shapes better outcomes and how customization must be supported with elevated clinical standards. Today, we bring those ideas together and talk about regenerative treatments like polynucleotides and skin boosters. These treatments are widely talked about today and often they are clearly misunderstood. So in this episode, we will be talking about what they are, how they work, and how they fit into a well-planned, personalized approach. Joining us today are two internationally trained aesthetic doctors who both bring global clinical experience with a strong focus of evidence-based, patient-centered care. Please welcome Dr. Sophie and Dr. Walter.
Hi, I am Dr. Sophie from Germany, an aesthetic medical doctor dedicated to innovation, science, and longevity medicine. Welcome to InMore Clinical Conversation, a space where we explore advanced techniques, breakthrough technologies, and the latest science in aesthetic and regenerative medicine. Join us as we deliver global knowledge for you, clinical insights, and meaningful conversations that inspire better patient care.
Hi, I'm Dr. Walter. I am a doctor in aesthetic medicine and cosmetic surgery. Patient safety and patient satisfaction will always be my top priorities. In today's fast-growing aesthetic industry, there are so many products, machines, and trends. But the real question is, what is truly right for your patient? At InMore Clinical Conversation, we talk about ingredient research, advanced technology, patient-centered care, and science-backed studies that help doctors make better decisions.
Hi guys, welcome to the podcast.
Thank you for having us.
Yeah, it's our pleasure. Are you guys ready?
Yes,
All right,
we are.
let's do this. But before I begin, I would like to share a quick fun fact, especially to Dr. Sophie. And I'm sure Doc Walter would agree on me on this.
Thank you for having us.
Really, it's an honor to be here.
It's our pleasure. Welcome to the podcast. Are you guys ready?
Yes, we are.
All right. Before I begin, I would like to share a quick Filipino fun fact, especially to Dr. Sophie. And I'm sure Doc Walter would agree on this.
Yes.
Dr. Sophie, do you know that in the Philippines, we have a term when someone struggles with English, we call it a nosebleed. So hopefully, no nosebleeds today. Alright, so moving on. I'd like to start on a more personal note. Can you briefly introduce yourselves and maybe share how you feel about being part of InMore Clinical Conversations?
Thank you so much for having us here today.
Yeah.
My name is Dr. Sophie. I'm originally from Germany, based in Spain, in Barcelona. I'm an aesthetic doctor, cosmetic surgeon, and integrative physician. So this wide field, I think, brought me here today to the Philippines because I'm seen maybe as a speaker internationally, but the aim is just to share my personal experience in my clinical daily practice and have a great conversation with Dr. Walter here.
And I hope you're enjoying your stay so far here in the Philippines.
Absolutely. It has been so nice, and Philippines are so friendly. The food is amazing and the country is just amazing.
Yes, hello everyone. I am Dr. Walter Laurel. I am an aesthetic doctor. Well, I am a pediatrician before for 10 years in the US. And when I moved back here, I took my second field in aesthetic medicine and cosmetic surgery. And now I'm loving every single moment of it.
Wow, that's lovely. So, what led you both to start incorporating polynucleotides and skin boosters into your practices?
Good question. So actually, first of all, I didn't jump right into it. I was very suspicious because in Europe, you know, things come a little bit later, especially the products from Asia, from Korea. So first of all, I tried some brands and I honestly didn't see the expected results. So there was a huge wave of polynucleotides and skin boosters in Europe, but they didn't show the promising results. So I really wanted to first see which product gives me the right quality, safety profile in terms of the origin of the polynucleotides, which is very important for me, and also the efficacy, of course.
How about you, Doc Walter?
Well, of course, everyone wants to have clear and beautiful skin. And before, we were only using like moisturizers, creams, and lotions. And then this came along, the injectables. So it was something new, especially for us Filipinos. We're not used to injectable injectables before. And then when I started incorporating this into my practice using polynucleotides and other skin boosters, now everyone wants it. And this is my number one treatment in the clinic.
Right. So from your experiences, why are these treatments becoming more relevant today, especially across different countries or even different patient profiles?
Let me answer that first. Well, like after one session, you can already see a difference.
I agree. How about you, Doc?
I also totally agree. I think there were some gaps in the results that we were seeing on our can do the perfect filler treatment, the perfect toxin treatment, or even a perfect lifting.
As I mentioned before, patients were just using creams and topicals, and it takes months. It takes a long time to see beautiful and significant results. But once you started using these injectables, the effect is instant.
But we saw some gaps in terms of skin quality. So nowadays, I think people look much more for natural results, for really healthy skin, from beauty from the within. So I believe this is what changed the market and the trends towards regenerative medicine.
Yeah, and regenerative treatments are the thing nowadays, right? All right. So before we continue on, I would just like to backtrack a little bit. So how do you guys discuss to your patients what is a polynucleotide? All right. So because these terms are everywhere and often people don't really understand what it is.
Okay. Well, polynucleotides are basically bioactive and biocompatible ingredients that are actually these are DNA fragments that are extracted from salmon milk, which are the testes and the sperm of the salmon. All right, you don't actually put the whole sperm on it. You just extract the DNA fragments, which will cause when you inject it to the skin, this will stimulate more collagen and more elastin.
Wow.
And as we know, if you have more collagen, the more youthful looking your skin is, and the more elastin you have, the more snatched you become.
That was already a great explanation. I have not much to add up.
Yeah.
Just the only way how I explain it to my patients usually is put it very simple in words. So this is like a messenger, right? So whenever the cell function is not going right because of aging, because of oxidation, because of inflammation, the DNA particles of the polynucleotides just give the right information back to the cell how it should function better. And this is why we have improvements in terms of hydration, in terms of collagen production, and in terms of this glow that everyone is looking for.
Moving on, in terms of skin boosters, how are the skin boosters different from the traditional fillers? How do you guys differentiate it? Because most patients are confused about it. So how do you explain it to them, like the difference?
It's true, sometimes patients think that this is the same thing.
Yeah.
And we have to really educate them on this. So fillers are more like a shaping treatment. They improve structural problems, but polynucleotides and skin boosters, they stimulate some biological pathways in order to improve the cell function, and this is why they work so sustainable and so effective.
And you use fillers when you want to add more volume or if you want to contour the face, whereas you use polynucleotides and skin boosters to improve the texture of your skin.
For immediate effect, use fillers, right? But for the long-term quality, use
Yes, if you want to
polynucleotides
improve
and-
your skin texture, reduce
Yeah.
the size of your pores, if you want to help something that will address those fine lines and wrinkles, and this can also help with acne and scar healing.
All right. So who are the ideal candidates for these treatments?
Okay, well, everyone. Everyone can benefit from polynucleotides. So for teens and patients in their 20s, this can address the oiliness of the skin. This can also help with their acne and with the healing of their acne scars. And then for patients in their 30s, this can help address delay their skin aging. And this will also make their skin more hydrated and more rejuvenated.
All right. So connecting this to what we discussed in our previous episodes about personalization and elevated clinical standards, where do these treatments fit in a real clinical setting? And when do you usually recommend polynucleotides or skin boosters?
So when I look at a patient's face and skin, and I have the feeling that this skin needs a real powerful treatment and inner healing, right?
Yeah.
So then it's the moment for regenerative treatments. So when I see that something like skincare is not enough, when I can see that just a simple mesotherapy with nourishing ingredients is not enough, when a device just gives like very short-term results, this is where I go for regenerative and skin boosters.
Well, as I mentioned, that I think everyone can benefit from these skin boosters and skin
Actually.
treatments. Everyone has a different concern, regardless if you have acne scars, if you have fine lines, wrinkles, or you just want a more rejuvenated skin, then definitely you can offer this for your patient.
Do you guys prefer them using alone or as part of a combination treatment?
Well, in my practice, I can use them alone, but usually you can also combine this with other treatments such as your toxin, and it's safe if the patient is also doing fillers, even threads. This one is it has a lot of wide uses.
Yeah, interesting that you answered this actually, Doc Walter, because I believe that in some regions globally, there is more the trend for combination treatments and for mixing protocols, right? So I really like to see first what this specific treatment is capable of doing in a standalone treatment. And also, to be honest, my patients demand something like this. They really want to see if this is a good fit for them, if this treatment gives them the right answers. So if we start to mix, we don't know what was the cause of improving the situation.
So I'd love to hear your experiences when it comes to actual patients. But before that, let's take a step back for a moment. Okay, can you both share a bit of your journey and how you ended up in this field? Because both of you came from different worlds, right? So can you share your experiences and how did you guys ended up here?
That's a long story.
Yeah.
You sure you want to hear all of this?
Yeah.
So I actually was trained in Germany to be a neurosurgeon. A totally different topic, I know. But for me, it was always very important to see my patients in a more integrative way. So especially that I took a step forward, and within the neurosurgery I specialized in the treatment of chronic pain patients. So pain is something that doesn't come only from an organic problem, right? A physical problem. It's mostly related also to emotional issues, to psychosocial situations of the patient. So to look at the patients in a more holistic way gave me the idea to get more knowledge in integrative medicine. And integrative medicine opened up all of this big field of anti-aging medicine. And there is where I got to aesthetics. And then from aesthetics, I took a step back and came back to surgical field, which is cosmetic surgery. And now it's hard to describe actually my profession. I think it's a mixture out of preventative medicine, health optimization medicine, anti-aging, regenerative medicine, aesthetics, surgery, and all of that thrown together so that my patients get the best results from the inside and from the outside.
Okay.
What about you?
Well, in my case, I've always wanted to do something with skin and skin health and doing aesthetic treatments and using my hands to do procedures. And I was already doing a pre-residency in dermatology, but I got accepted in a very nice, prestigious pediatrics program in New York. That's why I went to the States, and then I practiced being a pediatrician there for 10 years. But when we moved back here to the Philippines, I said to myself that I want to do something that I've always been passionate about. That's why I went to aesthetic medicine and cosmetic surgery. And now it's something that I really enjoy because it provides me the work-life balance that I've always wanted.
Wow. What a lovely stories from our two doctors. So, all right, great answers. What a lovely answers. But we just want to get to know more you guys better. And let's backtrack a bit on a more personal note. All right. So what inspired you to become doctors?
I guess watching Grey's Anatomy. Well, I'm the first doctor in the family, so I think ever since I was a child, I've always wanted to become a doctor, and then thankfully my parents supported me in that decision. How about you, Sophie?
The family support is very important. I agree. So in my family, almost everyone is someone who's working in science in some kind of way, but not many are doctors. But for me, it was very important also to combine science with the personal contact of patients and helping patients. So this is when I decided that this is a great field where I can combine both.
So when did you realize that this was the path for you guys?
I had a special moment back then when I did my first internship, and I think I was 15 years old, and I was in surgery, and it was open surgery, abdominal surgery, like very tough for a 15-year-old. But someone told me if I put my fingertips right below the thorax, it will be just 2 centimeters away from the heartbeat. And this was just such a fascinating moment for me that I decided to become a doctor, because we have a great responsibility on helping people, and this is a profession that is something something very, very special.
Well, in my case, I think when I was 5, I've always visioned myself wearing a white coat, and I love the thought of helping people. When I was a pediatrician, it was very fulfilling helping sick kids. Now, as an aesthetic doctor, it's very fulfilling to help one face at a time.
So for the both of you, who influenced you the most growing up? Aside from Grey's Anatomy, of course.
You can go ahead, Sophie.
Me, myself, and I. And all my colleagues, obviously, because everyone brings their part in your own personal journey, right? And we all learn from each other. So I think it's great when we have this opportunity right here, right now, in InMore Medical Conversations. And this is what makes you wake up every morning and do your job and do it in the best possible way for our patients.
I think it's my mom because she was an employee in UP, and with that I was able to get my tuition free from kinder up to med school. So I was in UP for my entire life, and with her help I was able to be financially supported because she took care of the tuition, which means I don't have to pay anything. So thanks, Mom.
Today's conversations highlight that aesthetic treatments are evolving away beyond quick fixes. With polynucleotides and skin boosters, the focus shifts towards improving the skin quality at a deeper level. Guided by personalization, supported by standards, and grounded in science. If there's one thing that a patient remembers from this conversation, what it is?
Salmon sperm. 2 words. How about you, Sophie?
So to choose your doctor right, because he's the one who will treat your face and who will choose the right product and the right technique and the right approach.
To learn more about regenerative treatments and evidence-based care, follow InMore Medical and stay connected with InMore Clinical Conversations. In our next episode, we will continue exploring how innovations and clinical responsibility come together in modern aesthetics. This has been InMore Clinical Conversations. Thank you for joining us, and remember, confident outcomes begin with informed decisions.